Hey y'all, hey. So let's talk about it. I know. I've been missing for a little bit. Don't worry about it. We still talking about these body parts. Today we're gonna talk about your mouth. What's going on with your mouth? And whatever's going on with your mouth and all the areas of it, your teeth included, maybe you holding on to some of the stuff that's been bothering you that's in your heart and your soul and your mind, and it will not let your mouth heal. Um, just think about what's going on. Think about how you think about your mouth. Think about what's going on with your mouth. Think about the story that is associated with the issues that you have in your mouth. Think about how sometimes you clench your mouth really, really tight and you don't even know why. You don't even understand why. And now let's talk about it. Are you somebody who has, you lack understanding? You ain't trying to find a way to understand nothing. Okay. You are somebody who is very close minded. You may be somebody who has very limited ideas. You may be somebody who people say got a bad attitude all the time. You may be somebody who is, you say a lot of hurtful things to people. Your mouth is vicious. Remember that tongue is associated with your mouth. And y'all know what the tongue does. So let's talk about it. What about if you are a person that is a highly critical person that is always criticizing somebody, always finding something wrong with somebody? Are you somebody who is very judgmental? Are you somebody who is a rumor spreader just to be spreading the rumors? Are you somebody who has a lot of worry? Are you somebody who is very hard in learning how to nurture yourself or even speak well of yourself? Are you somebody who does not eat properly? Are you somebody who is has a lot of self hatred of of you? Are you somebody who is just you know hard to deal with? And it's a lot about the things that you say and the things that you do to people. So if this is you, some of these ailments that are going on with you, or some of these things that I describe are associated with you, and you got some issues with your mouth, and the issues could be a multitude of things. It could range from your tongue, your jaws, your teeth, your lips. All of that is associated with your mouth, the roof of your mouth, all of that. So think about all of the things that encompass the mouth. And is there something wrong? Have you been trying to figure it out? You don't know what's going on, but you know you got some of these issues that are going on, and you just want to figure out how can I fix it. So let's talk about how we fix it. So what I'm talking about is holistic stuff. We ain't talking about no medicine. We're not talking about, going to the dentist and all of those things, although you should be doing all of your things that are associated with your mouth. So go see the dentist. If you haven't seen a dentist, go get those teeth out your mouth. If those teeth are no good, do all of the things. But if you are under the services of any healthcare providers, all of the stuff that I'm talking about, we're going to talk about some herbs. And if you want to add some herbs to your regimen, but you are currently taking medication, you want to make sure you consult every doctor that's taking care of you. Every single one. Whoever you go to the doctor for, let them know you want to add something to your regimen. And if you're taking medicine, I want you to go to see a pharmacist. A pharmacist will tell you if I add this herb, what I should take away, what I should add. You need to go back to your doctor because there may be an interaction. All of the things. Don't try to do it on your own. Let a professional do it, and let's keep on talking about it. Also, if you're thinking about getting a holistic practitioner, do some research, find out who they are, where they are in your community, add them to your care team if you can. Figure out, can my insurance cover it, or is this going to be an additional out of pocket expense? Also, if what we're talking about, you still got a lot of those issues that's going on in your heart, mind, and soul, and you can't get past them independently, you may need to talk to a psychiatrist or a psychologist so they can give you some more tools or some more medicine or some medicine so that it can help you along the way. So let's talk about some things that you can try to do on your own. One, let's journal. Get you a notebook, put on that notebook whatever you want to call your journal. Start to document why are you feeling the way that you're feeling. If any of the things that I mentioned to you are things that are associated with you, get in your head and start to ask yourself why. When did I start being closed minded? When did I start being so judgmental? And then ask yourself, what happened when I was that? Why am I like this? How come I can't get this feeling to go away? Dig a little deep. It might get ugly. And so when it gets so ugly and you get that blockage and you can't push past it, then that's when you might need to seek some additional help. But if you can push past it, figure out the why you're right there, Then work on, okay, how can I relieve this? How can I take this away? How can I get this out of my system? How can I open up my mind to different things? How can I slowly do this process? This is not an overnight process. This is not something that's gonna, go away tomorrow. So you're gonna get your journal. You're gonna journal all of those things, whatever is bothering you. Figure out the who, what, when, why, and where. All of those things that are associated with you, or all of that thing that is associated with you. And as I mentioned before, see all of the people so that you can heal whatever's going on in your mouth on a level of seeing a doctor or something like that. And then you can work on healing what's going on inside of you. So be present with your mouth. What's going on with your mouth? What's going on with your teeth? What's going on with your jaw? What's going on with your breath? When I eat up food, how do I feel when the food is in my mouth? Um, am I not chewing with all of the teeth and all of the different associations with the teeth? Am I only chewing on one side because one side is one way? Think about all of those things, because all of those things could contribute to some of the things that are going on inside your mind and your body. Learn to relax. Relax in your jaw, relax in your mouth. Are you somebody that holds your jaw really, really tight? What's going on with that? Why are you holding that jaw really, really tight? Are you somebody who got chronic teeth pain? What's going on with that? Are you somebody who, teeth need to be, fixed or pulled or whatever? Get it done. Just, go, I know we're scared. A lot of us are scared of the dentist. Go get it done. Get those bad teeth out of your mouth, because then that might be the reason that you may feel better. There may be something associated with your teeth that have you feeling the way that you're feeling. Um, like I mentioned, what does your chewing look like? What does your breath smell like? What's going on with your breath? Does your breath smell stale all the time? Even after you brush your teeth, you just have a moment of freshness. What's going on? And so it may make you have to dig a little deeper, because it may be deeper down is why your breath is smelling that way. But one thing you always have to do is affirm that you want whatever those feelings that you are feeling that I mentioned, or any emotions that are associated with that. Why are you feeling them that way? And affirm that those are cleared from your system. This should be an everyday practice. Um, ask that you are given the most vitality of your mouth, the most flexibility within your jaws, your teeth, and so on and so forth. Complete healing within your mouth. Those are things that you want to ask for on a regular basis. Um, Mouth breathing, practice it. It will help you. Do a little research on what mouth breathing will do for you, as it aids in you learning to relax your mouth, getting some of the stress out of your mouth, getting some of the stress out of your body. It'll help. Do a little research. And if all else fails, you need to see a psychiatrist or a psychologist to see what other tools that they can give you to add to your toolbox. Now we're going to talk about some herbs, my favorite thing. And when we talk about these herbs, y'all know, let your doctors know. Talk to the pharmacist so that he, she, or they can make sure that you are not overlapping anything. So let's talk about it. Cloves. Cloves are going to be your best friend when it comes to your oral hygiene. As you see, if you look at mouthwashes and toothpastes, they are now adding cloves. Why? Because cloves has antiseptic properties, anti-inflammatory properties, analgesic, which is pain relief, and antibacterial properties. You can take it as oil, you can swish, you can chew the actual thing. You can do a lot of stuff with cloves. Do a little research. Peppermint. Peppermint is going to be your antibacterial for your mouth. Sage. Sage has antibacterial properties, astringent properties, and I brought antibacterial twice. Uh, Licorice root. Licorice root is going to have antimicrobial properties, and it is going to have anti-inflammatory properties. Neem. Neem is something else you're going to find in a lot of rinses and a lot of toothpaste nowadays. So it has antibacterial properties, anti-inflammatory properties, and it is a plaque preventer. If you Now myrrh. Myrrh has antibacterial properties as well as astringent properties. Calendula. This has anti-inflammatory properties. Thyme, or thyme, however you want to say it. This has antimicrobial properties. Echinacea. Remember, echinacea is one of those ones that I tell you, you take it in short spurts and you have to make sure that you take a break. Echinacea, anytime you take it, I do not recommend anybody take echinacea more than 30 days without a break in between it. So don't just keep taking it, keep taking it, keep taking it. Take a little break. I usually will do a month on, a couple weeks off, and do another 30 days. That's my regimen. Find out what works for you. So echinacea is your immune booster. Remember, we always need to make sure that our immune is boosted at all times. It will aid in the overall wellness of us. And it also has anti-inflammatory properties. And parsley. Parsley is a antibacterial. You can put it in your salads. You can sprinkle it on whatever. You could take it in a drop. Do those things. These are the things that will help to aid in a better mouth for you, clear up some of the things that may be going on with you, not only in your mouth. Everything starts in the mouth that goes inside of your body. Well, a lot of things start in the mouth that goes inside of your body. So you want to make sure that your mouth is the healthiest, and you want to make sure whatever is preventing you from getting all of the greatness of the things that you consume, if they're great, that you are consuming them properly, they are getting to the right place. Because if you have hurt, pain, sadness, or whatever held in your mouth, I can almost guarantee that you're not getting all of the things that you need. So, somebody's mouth is messed up, bothering them. Share this with them. Like, share. Let's talk about let's get engaged. Let's talk about some of the mouth issues that you may be having and what can you do for them. And yeah, share this out. Send this to somebody. Give me some likes. Peace to the next one.